Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, if we see the Helicobacter pylori, now diagnosis of Helicobacter pylori. So, for the diagnosis of Helicobacter pylori, what is the gold standard for diagnosis of Helicobacter pylori? Histological visualization of Helicobacter pylori bacteria is the gold standard diagnostic test for diagnosis of H pylori infection. Then how are you going to visualize it? There are some special stains by which we can visualize the H pylori organism. We can visualize it by silver stains or Giemsa stains, or we can use Genta stains, or we can also use Warthin starry stains can be used for the visualization of the Helicobacter pylori, and it is the gold standard method. Then, but if method of choice to diagnose, if endoscopy is done, if we have done an endoscopy, then the method of choice is rapid urease test can be done if we have done the endoscopy of the organism. Serology is the test of choice for initial diagnosis. For initial diagnosis, the test of choice is serology, and after treatment urea breath test is done, is the method of choice. After treatment urea breath test is the method of choice, and it is performed 4 weeks after the therapy. We do this urease breath test, which is the diagnostic method of choice for H pylori infection after treatment. Then if you see, the accuracy in the diagnostic methods is also important, which we will see later.
thank you and thank you for watching.